15 years ago, I was living in remote Liberia, in an area so dangerous that UN peacekeepers refused to patrol. My lifelines were a satellite phone and, good luck. The same was true for those already living there. Need healthcare? Good luck.
Meanwhile, in Mathare North, Nairobi's sprawling Mathare North settlement, I was up before dawn to provide healthcare to my community. Despite my work and sacrifice, because I was not recognized as a professional, I struggled to support my family and serve my patients. I lacked essential supplies. I had nothing to take home for my children, nothing to show for the fruit of my labor. My kids were sent back home for lack of school fees. I was disconnected and demoralized.
Both situations were symptoms of a global healthcare crisis that spans from Liberia to Kenya and beyond. When a community health worker has to sacrifice her family, her well-being, so that you or I can be healthy, then she has made an unsustainable contribution. We came together to build a world in which community health workers were no longer the health sector's leading philanthropists.
We began as 6 organizations, but now a movement of thousands of community health workers and dozens of healthcare organizations spanning over 60 countries. Together, we are making professional CHWs the norm by changing guidelines, funding, and policy.
People often say changing systems sounds messy, complicated, but it's not. By unlocking the power of collective action, we can achieve breakthrough reforms at the scale of our shared problems. Think Lego. Small pieces, massive impact when connected.
Joining Community Health Worker Coalition transformed my life. Suddenly, I wasn't alone. I was part of a movement, writing research papers, speaking at global forums like this. And co-founding Kenya's first national CHW association.
Woo!
Our collective voices began to be heard. Today, I receive a salary that reflects my contribution. I have been able to comfortably pay for my kids' school fees. I have good nutrition for myself and family, given that I am HIV positive. I have a small piece of land in the countryside where I go when I need some peace and quiet. Yeah. Now I have somewhere that my children can call their own home. I'm very proud, and I'm very glad to be part of the success story, me and the community health workers in Kenya, to be part of the success story of Community Health Impact Coalition. Thank you.
Thank you. Now we know what you might be thinking. That sounds great, but it can't work in my field. Yet in this moment of hyper-individualism, of retreat, the choice before us has never been so stark or so urgent. Connect or collapse. In every sector, we are losing ground that we never, and certainly no longer have, trying to one-up each other. NGO market share battles? Waste. Hoarding, proprietary strategies, funding. Waste. Failing to collectively identify and change the conditions holding the problem in place. Waste. Our choice is clear. Connect, collaborate, win.
At Community Health Impact Coalition, we say nothing about community health workers without community health workers.
And we challenge the notion that proximity defines responsibility. We're all connected. Let's get it corrected.
When diverse voices and skill sets unite, systems can and do change. And there are so many coalition members here today in this room who are being recognized.
Stand up if you're a community health worker.
Woo!
A CHIC member. Stand up if you're a CHIC member.
Woo! Stand up if you're a CHIC funder, collaborator.
Funder.
Yes, funder. If you're a CHIC funder, just stand up. Stand up if you're ready.
Stand up, stand up, stand up if you're ready to join us in taking collective action to build the more beautiful world we know is possible. Thank you.
Thank you.